Hi, my name is Siti Nur Kamalia. I am the leader of Group 19. This video is for our assignment for Pharmaceutical 2. Today, I and my friend want to share with you guys about tuberculosis. Before we begin, let me introduce my group members. Siti Nur Khadijah binti Abdul Manan, Siti Nur Kamalia binti Jalil, Siti Nur Syahidah binti Mawardi, Siti Zulaika binti Bayani, and Siti Fatima Ansara binti Azana.
Hello and good afternoon to my teachers and my fellow friends. I'm standing here to present to all of you about tuberculosis. Tuberculosis is an infectious disease usually caused by Mycobacterium tuberculosis bacteria, MTB. Tuberculosis generally affects the lungs but can also affect other parts of the body. About 10% of latent progress to active disease, which if left untreated, kills about half of those affected. Most infections show no symptoms, in which case it is also known as latent tuberculosis. So, there are symptoms, risk factor, and treatment for tuberculosis. Thank you.
So hi guys, my name is Zara and I want to say about symptom tuberculosis or another name is TB. Okay, so first latent TB. Do you know about latent TB? Okay, listen. Latent TB is about person will have no symptom and damage will show on your chest X-ray. However, a blood test or skin prick test will have indicate that they have TB infection. Okay. The next about active TB. Active TB is about a person with TB disease my experience can hope that produce fatigue and fever. Okay, symptom TB will make a person will lose appetite and weak. So guys, you must know the symptom TB typically worsen over time, but they can also spontaneously go away and return. Okay. So next, TB can cause a persistently swollen lymph nodes or swollen gland. TB can abdominal pain, joint or bone pain, confusion, and a persistent headache and seizures. Okay. So that's all I want to say. Thank you. Bye bye.
I want to present to you all about risk factor. Risk factor. Some people develop TB disease soon after becoming infection before their immune system can fight the TB bacteria. People with weakened immune system are most likely to develop active TB. Overall, 5 to 10% of infection persons who do not receive treatment for latent TB infection will develop TB. For persons whose immune system are weak, especially those with HIV infection, the risk of developing TB disease is much higher. Generally, persons at high risk of developing TB disease fall into one point. Persons who have been recently infected with TB bacteria. These include close contact of a person with infection TB. Point number 2 is children less than 5 years old of age who have a positive TB. Some other health issues that weaken the immune system and can increase the risk of developing TB include. I have 5 examples to show you. One is low body weight. Number 2 is substance abuse disorder. Number 3 is diabetes. 4 is silicosis. And 5 is neck and head cancer. An active TB infection is contagious and potentially life-threatening if a person does not receive appropriate treatment. However, most cases are treatable, especially when doctors detect them early. Anyone who is at high risk of TB or any symptom of disease should see a doctor as soon as possible.
Alright, so this time I want to share how to take tuberculosis treatment. So I'm gonna start now. I want to show you a slide now about treatment of tuberculosis. Alright, firstly, treatment should be taken for 6 to 8 months because tuberculosis treatment to completely kill all bacteria takes time. Alright, next, medication should be taken under the supervision of a trained health worker throughout treatment. This to ensure the patient completes in taking medication. Therefore, care must be taken not to stop taking medication. Alright, okay. Then, daily treatment for the first 2 months, followed 2 times a week for 4 to 8 months. Where in the first 2 months is the extensive phase and 4 months is the extension phase. Okay. So if this treatment is fully followed, the patient can be cured. Therefore, it is very important to keep you completely healthy. Alright. So let's look drug. There are 4 of special drugs that are often used to treat tuberculosis. The drugs are rifampicin, isoniazid, pyrazinamide, tamsutil. And try to see the picture here. This is also one of the TB drugs. Okay, you can see the names of this drug here. And let's take a look at the objective of tuberculosis treatment. Among them is first, cure patient from tuberculosis, then reducing the risk of tuberculosis infection to others, and also prevent tuberculosis from getting a recurrent TB infection. Well, that's the only treatment, so that's all I can share how to treat tuberculosis. Hopefully what I share is beneficial for you, and thank you very much.
I will share with you guys ways to prevention of tuberculosis. As with all health conditions, prevention of TB is always better than a cure. There are a number of measures that can be put in place to reduce the spread of the illness. The first is the BCG vaccination. The vaccine is prepared from a strain of weakened bovine tuberculosis bacillus, Mycobacterium bovis. The BCG is currently the one licensed vaccine against TB and has been used since 1921. The second is early diagnosis. A person with infectious tuberculosis can infect up to 10 until 15 other people per year. But once diagnosed with TB and started on treatment, The majority of patients are no longer infectious after just 2 weeks of taking a medication. The third is managing your environment. The bacteria are released into the air when someone with infectious TB cough or sneeze. The risk of infection can be reduced by using a few simple of precautions. First is natural light. UV light kills off TB bacteria. And the second is good hygiene. Cover your mouth and nose when you cough or sneeze. The fourth is a healthy immune system. 60% of adults with a healthy immune system can completely kill TB bacteria. There are 3 ways to prevent tuberculosis from infecting others. The first is wear mask. Cover your mouth and nose with tissue and wearing mask when you cough or sneeze. The second is wash your hands. Wash your hands regularly and after cough or sneeze. The third is use fan or open windows. Use fan or open windows to move around fresh air. Thank you.